Our basic plan is Bankmed's low contribution plan for members with in and out of hospital needs and chronic disease care. The plan offers a rich variety of wellness benefits. It has restricted networks, which include the Bankmed GP Entry Plan Network, Specialist Network, Hospital Network, Dental Network, Pharmacy Network, and Optometry Network. Remember, using our networks protects you against having to pay any extra expenses. GP Entry Plan Network consultations are unlimited, so long as you nominate your primary GP from within the network. That GP will send a member to a specialist within the specialist network. If you choose to be admitted overnight to a hospital outside the network, there will be a 20% co-payment, which means you'll have to pay in 20%. Acute medication is subject to protocols and formularies, which is our prescribed list of medications. Procedures that are done in your GP's rooms are also subject to a prescribed list of formulary. It's important to remember that while the basic plan gives you wide healthcare coverage, it is limited to basic services. Your basic dentistry needs are covered, subject to clinical protocols, but the plan doesn't cover you for crowns, caps, or orthodontics. You'll have unlimited cover for chronic medication, subject to prescribed minimum benefits, known as PMBs, a chronic disease list, protocols, and restricted formularies. Visit the Bankmed website to see which diseases are covered. For eye care, you can get prescription spectacles through the Isoleso Optometry Network. HIV and oncology cover is limited to prescribed minimum benefits only. The basic plan doesn't have a savings account or an above threshold benefit. If you're already on this plan, you'll be pleased to know that Bankmed has once again increased your current benefits and added new benefits for 2018. At the same time, we've managed to limit your contribution increase to 6.5% and increase your benefit limits by 5.5%. Let's look at some of the new wellness and preventative benefits for 2018. Non-invasive prenatal testing is now available for high-risk pregnant women who are 35 years or older at delivery, women who have had a previous pregnancy with trisomy 21, 13, or 18, or where a fetal ultrasound or other screening findings have shown a high risk for Down syndrome. Another new benefit is newborn screening, including the early screening, diagnosis, and management of selected rare inherited diseases, such as phenylketonuria. Glaucoma as a screening test has been removed, and a pneumococcal vaccination is now necessary only once every 5 years, unlike the current provision of once a year. There are also new guidelines for network arrangements. An additional network is Premier Plus, which allows for a disease management program for diabetes mellitus and heart health. The day surgery network now includes a defined list of procedures. For example, an endoscopy, colonoscopy, tonsillectomy, circumcision, or myringotomy. If you voluntarily use a facility that's not in the network, there'll be a 1,500 Rand co-payment you'll need to pay in. Likewise, there is a 20% co-payment if you use a psychiatry facility that's not in the psychiatry network. If you're treated for major depression, bipolar mood disorder, or schizophrenia, you can now have a psychiatric consultation within 30 days of being discharged. And if you need medical and surgical appliances, take a look at the benefits and contributions schedule to see how many you can have and how often. Remember, we value your health as much as you do. Here's to your good health.